Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing.
Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ano ko. May dugo na yung plema ko. Di pina-x-ray nila ako. Mayroon ng findings na mayroong bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita mo, bukol sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na ako nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank. Malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR. Pagbalik ko, salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa mabiopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan-gaan na magaan-gaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po na yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom. Nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na pre-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo.
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nag-iinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas niyo sa CT scan niyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, nung pag-combine po ninyo ng PPARS at saka po ng GPT po this past months po. Ano po yung mensahe na pwede nyo pong maibahagi sa kanila, sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayong mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang inom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po, no, sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday. Hi everyone! Have you ever wanted your oncologist, your surgeon, and your integrative doctor all on the same stage at the same time to answer your questions about cancer and your cancer journey? Well, the opportunity is now right here. It's happening. Simply Healed is going to have its second face-to-face event, Beating the Odds, Medical Nutrition, Oncology, Surgery, and PPARS in Fighting Cancer. So join us on July 27th at SMX Aura, 8 a.m. Click on the links below to register for on-site or join us via Zoom. See you there, July 27th. Hi everyone, these are the important questions.
Is the night you have been waiting for. We are going to discuss natural solutions for psoriasis, eczema, and atopic dermatitis that targets the root cause to stop the itchiness and break the itch cycle. But before we start, I would like to know, where are you watching us from? So please comment down below your location and shout out to the viewers from Makati. This is a free webinar, so please tag and share with your family and friends. Okay, ramdam kong kating-kating na kayo. So let's get started by calling on our seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him. It's no other than Mr. Shyan Lim. Next, it's an honor to present our second esteemed speaker, Dr. Jansen but also the International Board of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Let's all watch this.
Hello everyone, welcome to another episode of Simply Healed, and with me today is Dr. Jansen.
Hello everyone, hello Shan, glad to be here again, and welcome to our webinar tonight.
And tonight's episode is a special one. I want you, all those who are here tonight, I want you to share this with all your friends and family because tonight we're going to definitively answer what is eczema and psoriasis and why are your loved ones and friends suffering from this. So please share it with your friends and family who are suffering from eczema and psoriasis, because this patients who suffer from eczema and psoriasis, it's not just the physical pain that they go through. There's a lot of emotional turmoil.
Yeah.
And imagine, if you're a lady and you can't wear sleeveless, your hands, you may have to wear gloves because there's pus.
Yeah.
It destroys their self-esteem, their confidence, it leads to depression.
Yeah, they can also be bullied.
They can be bullied. Yeah, kids are so mean. If your daughter has eczema, people say, disease. They'll be made fun of. Oh, it's terrible.
It's really sad.
It's really terrible. And let's flash this up on screen right now. We start this very special episode. So to everyone, please bookmark this video so that if you ever meet anyone who has eczema and psoriasis, show them this video, you will change their life, all right? Because tonight we're gonna definitively discuss what it is and that it can be solved.
But let's start with this bold statement by Mayo Clinic, one of the most famous clinics in the world. It says here, this article was actually written in 2011. That was 10 years ago. It says steroids have been used for 50 years, and it's amazing because it's really not a cure.
Yeah, it just solves. It's a short-term solution, so it just solves the superficial problem and not the underlying one.
Doc, you mentioned that you've seen people who use steroids for a long time. Even when you were as early as when you were a med student.
Yes.
Yeah, maybe you could share what you saw.
Yeah, so there was this lady who came to us. This lady actually has Cushing syndrome. Okay, so back then I was a student. You know, our professor was trying to teach us how to interview, try to discuss what Cushing syndrome is. So basically, what Cushing syndrome is, the person has a buffalo hump.
Wow,
the person has a moon phasie, obese.
Wow.
And that patient of ours also has diabetes and osteoporosis. Okay, so yeah, and probably has coronary artery disease as well. Now, this lady, this patient of ours, was already on 30 years of steroids.
30 years of steroids.
30 years. Yeah, it's because of the arthritis, because of the skin disease that she has. That's why she has to take. She has to be on steroids for a very, very, very long time. And one of the major side effects of long-term steroid use is, Cushing syndrome.
And Doc, you know, it's not just oral steroids, right? When you use steroid creams, it actually enters the bloodstream.
Yeah, it can. Yeah. Okay. So anything that you put on the screen, on the skin, especially the topical medications, it can actually be absorbed through the skin.
And it thins out your skin.
Yeah,
it thins out your skin.
Thin out your skin as well. That's one of the side effects of steroids.
And also, topical steroids are not advised to be used on the face, right? Which is a big issue for patients who have eczema and psoriasis. What is psoriasis and eczema? Isn't it a skin disease like and like any skin disease, like a mosquito bite? We take an ointment and we apply.
Right. Okay. Now let's go for psoriasis first. Okay. Let's discuss psoriasis first. Psoriasis is actually an autoimmune disease. So by autoimmune, it means that your immune system attack your skin. Okay. That's why you have that scaling, that plaque on your skin, which is what we call psoriasis. Okay, so that is basically what psoriasis is. So how do you then tone down your immune system? It's very important that you eat a plant-based diet because the plant-based diet has high antioxidants. Now, if what you're eating has high antioxidants, then it will tone down the immune system, or it will tone by the overactive immune system. Okay, so what you need are immunomodulators, food that has immunomodulator properties. Okay, so that is what psoriasis is. Now, eczema is tied very closely to psoriasis. Now, psoriasis is an autoimmune disease. Your immune system attacks your skin. Eczema is a different one. Eczema is an overactive immune system with a lot of inflammation. That's why your skin has a lot of redness. Okay, that is a manifestation.
So it doesn't attack the skin per se like psoriasis. That's why you don't see the severe flaking of psoriasis.
It is hyperinflammation. Hyperinflammation. Yeah. Okay. So that's the difference.
So Doc, there's also this term not so familiar in Philippines but elsewhere in the world, and we have international viewers. Like for example in Taiwan, they don't say eczema or psoriasis, they say AD.
Yeah, AD, atopic dermatitis. Yeah. So eczema is a general term. It's an psoriasis is an eczema. Atopic dermatitis is an eczema. Okay. So, but you know, with these classifications, each disease actually has similar root problem, which is the immune system, an overactive immune system. So why do dermatologists prescribe steroid creams? It's because steroid creams suppresses the immune system. If it suppresses your immune system, the inflammation would be not that bad. And if the inflammation is not that bad, then you won't have the symptoms that you're feeling will decrease. Okay? Now, the problem is with steroids or steroid creams is you cannot use them for a very long time. The limit is 14 days. After 14 days, you have to rest your skin, then apply it again. But the problem is, if you don't address the root problem,
It gets worse and worse over time.
it just comes back. It gets worse over time. If not, if you improve, well and good, but it will come back. Okay? If you don't address the root problem.
So how do we address the root problem? To address the root problem for eczema and psoriasis is not to focus on the skin.
Yeah, you have to focus on the inflammation that is caused by your overactive immune system.
So at the end of the day, we cannot just even, if we target inflammation, again, it will be like applying cream. Because the inflammation is actually caused by the root cause, which is something is off with the immune system. If we don't put the immune system back, you will forever be dependent on the crutch. You need to manage your inflammation, you need to manage your skin antihistamines, right? So the thing is still immune system.
Yeah, so you have to have a smart immune system. Okay.
So to all the eczema and psoriatic patients listening into this program right now, you're not looking for an immune system booster. And most of your treatments right now is a temporary immune suppressant, right? Just like antihistamines. So what you're looking for, the solution is an immunomodulator,
yes.
right? Get that word into your heart. You can Google it, search it. It's basically to make sure that your immune system works normally.
Yeah, so
not hyper and not hypo.
Not hypo. Yeah, because if your immune system is suppressed, immune system so low, you'll be prone to infection. You can die from infection, of course, you know. Yeah. And if your immune system is hyperactive, then you have those flare-ups.
Eczema and you have those flare.
So you need to be somewhere in between. You need your immune system to function the way it's supposed to be. If you have an infection, and at the same time, if you don't have an infection, if you don't need the immune system, the immune system should be toned down. Okay, so it has to be.
So what we need a smart immune system. What treatment are you looking for? You're looking for a treatment that affects it's an immunomodulator. It modulates your immune system. Yeah. So what would you recommend as immunomodulator? So how do you bring your crazy immune system, which is too hyper, which is why eczema and psoriasis, how do you bring it back to a normal, sane working condition?
Okay, so number one is for you to eat a lot of antioxidants. So plant foods, again, okay? Number two is Simply Nature PPARS, because Simply Nature PPARS or the microalgae is an immunomodulator in itself.
Wow,
okay?
It's not just an anti-inflammatory, it's not anti-inflammation, it's not an immune booster only, it is an immunomodulator.
Yes, so if you feel a lot of these flare-ups inside your body, you can actually take Simply Nature PPARS to lower or to tone down the inflammation. Okay?
And to all our viewers out there, for me, this particular topic is actually personal because my wife suffers from eczema. All right, and after taking Simply Nature PPAR tablets for a period of a month or so, she started to see other improvements in her body first, which is like her menstrual cramps and everything. But for her eczema, it took about 3 months, right? She loves to eat prawns, and every time she eats prawns, and if she eats crabs, for sure there will be an outbreak, all right? Even though she's taking Simply Nature PPARS, if she takes crabs, the redness will come. Yeah. But you know what's so amazing? The amazing thing is that the next day, her redness will disappear. So it will come down on its own. And this is what Doc Jansen is talking about. So to all the eczema and psoriatic patients out there, I know you've tried many remedies. They have not worked, or they worked temporarily. You got well, but then the eczema came back. And the reason Doc clearly said is because you took a very effective anti-inflammatory, all right? So you don't see a redness. You may have taken something that was a very good antihistamine. It blocked the reaction, which is why your eczema subsided. But then it always came back. Why? The root cause, your immune system, was never modulated. But for my wife, it restored, the PPAR tablets restored her body's ability to modulate its immune system, for the immune system to function normally. So that even when she takes things that trigger her immune system, it could normalize itself within a very short amount of time. And of course, if you take the soft gels or extracts, then you will see the subsiding of all these symptoms very quickly as well. But here's really the thing. over a longer period of time, 3 months and above, you will actually see that the immune system is modulated, is corrected. You know, doc, cases worse than my wife. Look at these psoriatic pictures here. These are 3 months. 3 months mono protocol. They weren't using much of anything else, just PPAR tablets. Look at this guy, psoriatic. The skin is all scaling. It's all became normal. The skin got to recover. And this is very encouraging. I want all the eczema and psoriatic patients to know that this is not something you apply on the skin, right? We are taking it orally, goes in long term, your immune response to modulate it. And this is the result.
Okay, yeah, so point number 2, again, don't eat the things that you should not be eating.
Don't
so
trigger.
That is seafoods, eggs, chicken, dairy products, on some degree chocolates as well, okay? But our chocolates are actually...
Trigger.
Yeah, dark chocolate is a better option than milk chocolate or white chocolate, okay? So, but remember the triggers. Eggs, dairy products, seafood, chicken, okay? Those 4, okay? Now, let's go to number 3. Number 3 is a high fiber diet. Why? Your probiotics or your gut health or your gut microbiome has a big influence on modulating your immune system. Okay? It has a direct influence on the manifestation of AD. Okay?
Wow.
So how does it work? So with a high fiber diet, so fiber is basically prebiotics. Okay?
Yeah, it's what your good biotics eat.
Yeah, that's
keep healthy.
yeah, correct. Okay, so that is what your bacteria or your gut microbiome eat. Okay, the fiber. So Cleansing Plus is a fiber supplement. So now, when the gut microbiome eats these or metabolizes the prebiotics or the fiber, they secrete short chain fatty acids or butyrate. Okay, so the butyrate is the one that modulates the immune system. Mind you, not just atopic dermatitis, asthma as well. Okay, so for those of you who have asthma, most likely you have, if you have atopic dermatitis, you'll most likely also have asthma. So that can, the asthma can also be modulated by a high fiber diet. Okay, and number 3, you have to apply something on your skin. Of course, you have wound. Okay, wound from scratching, abrasions. Okay, so it would be better if during the days that you're off steroids, put in a probiotic serum.
And we have that in Simply Nature. In fact, actually, Doc is the first in the world right now that we know of, therapeutic level of probiotic for the skin. So it's not like those probiotic that you see, probiotic that you see in cosmetics, like moisturizer with probiotics. That is just to keep your skin moisturized. This is probiotics specifically designed to curb the Staphylococcus count. So what that is, Staphylococcus is the bacteria that's responsible for the redness and for the infection, right? And you can see from this chart, every time the eczema and psoriatic patient has a flare-up, look at the type of bacteria that's on your infection. And until sometime your skin really gets damaged, that its ability to heal is actually compromised. And that's where you have permanent scarring and the scaling in your joints and your fringes of your scalp and so on. And that is the vicious cycle, Doc.
Yes.
So we have a solution. You take the Simply Nature PPAR protocol to modulate your immune system, but that takes time. That takes time. As we saw in our work with the Center for Disease Control, CDC in Taiwan, it took 3 months. So in between the 3 months, you're still going to have your flare-ups.
Yeah.
And then you need something. So instead of putting a steroid cream that again damages inside, put a AD Pro, which is a probiotic to help help the breakout come down. How fast does it work? It literally works within 15 minutes. When my wife has a flare-up, she applies the AD Pro. Within 15 minutes, the redness, the swelling goes down. Doc, in fact, your brother has tried AD Pro.
Yeah, my brother has tried AD Pro. It immediately reduced the redness in the scaling.
He has eczema?
Yeah, at his nape area.
The nape area. It's really interesting. I mean, for those of you who don't have eczema, it's you won't understand. But some eczema patients here is on the fingers, some is on the nape, others is on the T zones. It's really something very frustrating.
Yeah.
And if any eczema patient says, you know, I don't care, it's okay. It's not because you don't care, it's okay. It's because you've tried so many things that you've learned not to care.
Yeah.
You know, it's like, okay, I'm not handsome, so I have to learn to deal with it, right? But you know, if you could be like Cinderella, you know, if the fairy godmother comes and can transform you, you would not say that you don't care. So tonight, start caring again, because whatever condition that you may have, your eczema and psoriasis.
So probably we can just give them a summary, you know. So as a summary of the treatment protocol. So how do you approach eczema and psoriasis? Go on a plant-based diet. Avoid eating the foods that can trigger these. Cleansing Plus, PPARS Plus tablets, AD Pro. So those are the solution.
Addressing the immunomodulator. You got to have immunomodulators. So not just antihistamines, not anti-inflammatories. Those are temporary. That's why your eczema keeps coming back again and again. Now let me before we go to our AMA, Ask Me Anything, I want to share one of the most severe cases by one of our own doctors here in the Philippines. So one of our doctors prescribes soft gel capsules for psoriatic patients, and she buys a lot of it, and a lot of it is actually for her own sister, right? So her sister has had psoriasis for so many years, and it's so bad that every 6 months or so, she has to have injections injected into her joints. Oh, wow. So those of you whose psoriasis is not that serious, if you ignore and don't do anything, and if your immune system goes even more out of whack, you're going to have psoriatic arthritis.
Psoriatic arthritis.
That's so painful.
Yeah.
And can you imagine every 3 months taking a needle, injecting into your knee and your joints? So she really felt for her sister, and she put her sister on soft gel capsule. So after she did that, after 3 months, 6 months, I think they went for one final jab, all right? And then after that, no more injections to the joints. Wow, that's fantastic. And her sister is total body psoriasis, right? It's not just the fringe of your scalp. So this really, really helped her. Is she still suffering from psoriasis? Yeah, there are still psoriatic symptoms, because this has been a 20-30 year disease, and she was so serious. She was using all these strong medication, injecting already. So that healing process takes a longer time. However, she's no longer having to inject into her joints, and that in itself is such a wonderful progress. All right. So with that last example and success testimony, let's move to our
There we have it. So at this point, questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. But just before we go to our AMA or Ask Me Anything portion, quickly, I just want to get our avid viewers, Miss Mavs Agot, Susan Osorno from Rizal Medical Center. Salute po sa lahat ng healthcare professionals. Oh, and I would also like to thank Ma'am Christine for tagging Crisel and Samu Pahanel from Cavite, and Dottie Lumberio Espargo from Masbate. Oh wow, we also have viewers from Iligan City. Now, to answer all your questions in this modern world filled with noise of different health opinions, only trust the ones from the experts. May I call on once again Mr. Shyan Lim.
Hi, Jhen. And also, this is something that is personal, first-hand experience in our family. So, yeah, looking forward to the questions. So, let's go, Jhen.
Yes, so first question coming from... Okay. I'm sorry, hold on a minute. Okay, from Matilde from Pasig. What is the best thing to do to slow aging of my skin?
Some confidence that anti-aging is possible and it is real. Okay. Now, let's talk about external. For guys, actually, guys, you don't need to buy a lot of expensive like serums or anything like that. The very basic thing that can change the anti-aging for a guy is literally putting on moisturizer. Okay. A male's skin is 7 times thicker than a female's. So actually, we are very blessed. We don't need to spend a lot of money on skincare. But one thing we need to do, get a good moisturizer, and that will really keep you looking young. Internally, when we are things that we eat. Okay, so actually, Simply Nature PPAR tablets is sufficient for anti-aging. Okay, if you have the budget, you can occasionally, like once a year or maybe once or twice a year, depending on your budget, you want to go for the extract powder. Okay, that's like a tune-up for your body to help the anti-aging. But what is important for anti-aging is the tablets and to eat it regularly. One of the best vitamins that you can take for anti-aging is actually vitamin C. Now, anti-aging also doesn't mean only good skin. Okay, so sometimes good skin is a lot about it is about genetics. There are some people who wash their face with just water. Okay, I can still run 5 kilometers. I can run for an entire hour. I can do pull-ups, chin-ups. I can participate. I can play badminton with people. I'm gonna chismis a little bit about him, right? So we were doing a how shall we say team building, and me and Dr. Jansen, our room, because it's like a team building resort, so they don't actually have elevators, right? It's like only 4 or 5 story building. So that day, our rooms that we shared together, I was rooming with Dr. Jansen. It was actually on the 4th floor. So we were carrying our luggage up. Archie said, chronological age versus biological age. Okay. Anyway, the good news is Dr. Jansen was challenged by that incident, and after that, he hit the gym, and he's also losing weight and getting fit and anti-aging right now. Okay. So the tip is the tablets. Or why? The tablets not only have antioxidants. One of the things that age your skin and age your joints and age your organs is inflammation. So Simply Nature PPAR tablets is really anti-inflammatory, right? So it regulates your inflammatory responses. It keeps the chronic inflammation down in your body. Do you notice some people, because of like arthritis and everything, they move like an old person because their joints hurt? And how many of you realize whenever you experience pain for a long time, your face starts to look more haggard, right? So if you have joint pains, people with joint pains look older. Than it requires so much energy to tolerate, and the inflammation in your body breaks down your body. That's why you feel the pain. So anti-aging question, Jhen.
Thank you, Sir Shyan. Next question from teacher Jocelyn from Talisay, Camarines Norte. Her question is, why do we have eczema?
Very good question. Okay. Very good question. I know your skin is painful and cracking and things like that. But what the problem is not your skin. The problem is your immune system. Okay. So what your immune system is doing is that your immune system is causing an overreaction. So let's say you just bump your hand a little bit, right? If you have a little bit of exposed to, okay, people with eczema, right? Eczema, psoriasis, you have triggers, right? If you're exposed to smoke, suddenly your face breaks out, things like that. So you can be triggered. So why does triggering your eczema cause pain and make it what it is? It's because when your body is triggered, your immune system overreacts to the point that your own immune system is attacking your skin, which is why you see the redness, why you see the breaking. Now, when your skin, and then it will send inflammation to the area, to your joint, okay, and the T-zones and all that. And what will happen is that the inflammation will cause you to itch. So there's more blood pump over there, and the body sends immune cells, macrophage cells, NK cells, all these immune systems starts to go over there to fight the mosquito bite, right? Because there's a hole in your skin now. Now, what happens for eczema patient is that you will start to itch. So when you scratch, you break your skin. After you break your skin, the viruses go in, which cause your body to send more immune system to go and fight it. But your body will always overreact for an eczema patient because it's an immune problem, right? It's not a skin problem, it's an immune problem. The way to really permanently treat or correct sufficient to help your body manage your immune deficiency or your immunodeficiencies. So if you have very serious eczema, start with the soft gel with tablets. Years ago, there was this doctor. The person himself is a doctor. When he ate tablets, not soft gel, not extract, just tablets, his comment was, it was the first time, I think, in 14 years, he had a proper good night's sleep. So for so many years, his skin itch and reacts, and it's painful because of psoriasis and eczema, that he couldn't have a good night's sleep. Now, just taking the tablets within the first night, he got relief. All right, so that's how fast it can work for you. Okay, now every patient and every person will be different. So I have another doctor, her husband has very serious psoriasis. Literally, when you look at a person, you will feel for the person, because like there's no part of their body where you can see smooth skin. So for him, because it was so serious, he actually took liquid, and actually he was able to correct and find relief and improve his psoriasis and eczema. Okay, so again, now when you have eczema and psoriasis, it's not a skin issue, it's an immune response issue. So that is why no amount of steroid creams and antihistamines can cure your eczema and psoriasis, because the problem is not on the skin, it's your immune system. Yes, it can. Okay, if your skin asthma is mild, tablets. Okay, you take at least 20 micro tablets a day, which is very small. Okay, the tablets are micro tablets, right? So what will happen? What will happen when you take these tablets, right? The PPAR agonist will start to help your immune system, regulate your immune system. That means cause your immune system not to overreact. All right. Now it will take time for the PPAR agonist to go in and normalize your immune system's reaction. Okay, how long will it take? It'll take about a month. All right, for you to see very significant results. Okay, immune system is being regulated and brought back to normal through the action of the PPAR agonist. What will happen is that you start to see your breakouts get less and less. And then when you do have breakouts, right, you will see your eczema breakouts improve. That means recover, right? All eczema patients, you're not in a perpetual state of like redness, right? It comes and it goes. So if you eat prawns or seafood, then for the next 3 days, within 4 hours that night, you break out, and then for the next 3 days, it's all red and it's painful. And then it takes you time to recover. So why does it take you time to recover? Very simple, right? Imagine you overreact. So it takes time for the level of your immune system to slowly come down, to calm down. CALM, right? To not be so excited. Now, what will happen is that as you improve and correct, system gets triggered, it also relaxes. It actually calms down faster also. So that means last time you find that your skin already go back to normal. Why? Your skin is still sensitive, not because the skin is sensitive, because your immune system is sensitive, but now your immune system is healthier, more modulated. That's why it will recover faster, right? It'll go back to normal faster. So that's how our products work to assist your eczema. And we have a new one called 80 Pro. 80 Pro, so you take PPAR tablets and PPAR soft gel capsule to deal with the immune system. But there is still another problem, right? If it's itchy, you scratch. If you scratch, you break your skin. If you break your skin, viruses and bacteria go inside. When the immune system reacts and makes your hand itchy again, and then you scratch again. So can you see that it never gets well? That's why for many psoriasis and eczema patients, this is something you've been suffering for 10 years, 20 years, right? And for many people, I know sometimes convenience, it affects our self-esteem, right? Sometimes we feel shy if our skin is not nice looking. You know, I have a friend who has very sad because of the way they look. So that's why, right? Try PPAR tablets and soft gel if your condition is serious. You know, it is really from the bottom of my heart that I understand the issue is sometimes more painful than the fever, because psoriasis and eczema affects the way other people react to you. So I really, really believe that this is something worth helping. You not only heal an illness, you actually heal a person's emotional heart, their self-esteem, and their psychology as well, their sense of identity. So this is very meaningful to me. All right.
Okay, before we go to our next question, I would like to greet more of our avid viewers, Miss Nessie Ocampo, Archie Hoxon, Edna Alarcon, and Zenaida Maranga. Okay, this next question is kind of advanced from Miss Marjorie Sugnay.
Okay.
She said, I've been using ointments and steroids for a long time. I try to avoid triggers as much as I can, but
Okay.
it still keeps coming back. What PPARS is good for me?
Okay. For you, if you have been using a lot of steroids already, that means I assume over the years, your psoriasis actually gets more and more serious. So I hope that my explanation just now helps you understand why your topical application, that means your steroid creams and all this, is not curing you, right? Because your steroid cream is an antihistamine. It blocks your immune, it causes your immune system to not trigger, right? But the problem is your immune system is not regulated properly, right? So it's now just suppressing your immune system. So the moment the steroid cream wear off, your immune system is not regulated, it's not suppressed. So it's the moment you're stressed or whatever, it triggers again, right? So what I would recommend for you is the soft gel capsule. Why the soft gel capsule and not the tablet? The reason is because you shared with me that you've been using steroid creams and all this for some time already. So I would want to recommend you the soft gel because it will work faster, because it is stronger. But it is not like steroids. You know, steroids, you use a stronger steroids, there are greater side effects, okay? But here it's not the case for us. The only drawback of the soft gel capsule is that it's more expensive than the tablets. But I think in your condition, you probably want to see results faster because it will give you confidence that, okay, now. So I would say go for the soft gel capsule for the first month, all right? Doesn't mean that your psoriasis and eczema your psoriasis will be completely treated to be managed in 1 month. No. But I'm still going to recommend a soft gel because I think as a patient, I'm sure you've used so many protocols. I just want you to see results so that you can feel hopeful. Okay. After that, if you think the soft gel is a little bit tight on your budget, okay, then you can go for the tablets. Now it will then take a longer time for you to recover your psoriasis, but it's going to happen. It's going to happen. Now, it will reach the point that your skin pretty much normalizes, okay? However, you will still experience breakouts. So if you're extra stressed or if you take foods that trigger you, guess what? You must, for the rest of your life, no matter how you strengthen your knee, and your knee could be so strong that it will be like the same as a normal person, but you still have to be careful with your knee. So if you ever get an injury on your knee will hurt more than a normal person because you were born with weak knees. Okay, but for normal operation, you can strengthen the knee until it functions as if like a normal person's. But you must be careful not to injure it because your knee was born a bit weak. So using that understanding as a psoriatic patient, right, a person with psoriasis, going on the PPAR protocols can really restore your skin to not be as serious as in the past, and your recovery from your breakouts will be faster. And some triggers may not even trigger your psoriasis anymore. So maybe last time, make sure you get good results so that you know that this protocol works for you, okay? And then after that, based on your tablet, right? So it will be slower, but it'll still work for you. Now, if you later realize you want it faster, you can always upgrade back.
Hey, hello, Shyan. Hello.
How was TCM class today?
Stressful, a lot of concepts already. So I have to study or else I'm gonna be left behind.
It's so good, right? I think to all our viewers, I hope you are encouraged and you have more confidence knowing that both Dr. Jansen and myself, even Dr. Jansen, so well versed, is still improving himself so that we can better serve everybody.
Okay. Thank you, Sir Shyan, for that enlightenment. And I would like to welcome our birthday boy, Dr. Jansen Calala.
Oh yeah! Happy
Hi.
birthday today! I wish
Hi,
you,
thank you,
but
thank you.
I forgot. So yeah,
Thank you, thank you.
Today.
Okay. So moving on to the next question. Thrown to us privately. Is it okay to take Cleansing Plus if I have Crohn's disease?
Okay.
Yes.
Johnson.
Yeah. With an improvement, with diversification of more animals in the zoo, okay, it will be better. Okay. Yeah. So of course the animals, your gut bacteria, fiber intake. So for that matter, cleansing plus would be really beneficial, no? But you cannot rely on cleansing plus alone, no? Although it is fiber, it's made from psyllium husk. You have to consume fiber from real food, no? Because
Important.
it doesn't end there. Okay, for the Crohn's disease to resolve completely, you have to have real food, no? Cleansing plus, the role then would be to say for example you are not fond of eating plant foods, no, which might be the reason why you have Crohn's disease in the first place, no. So cleansing plus would be a supplement that to increase your fiber intake. Okay, so that is the role of cleansing plus, and that is how it can help you. So it helps you in during the transition.
And then for this particular viewer, I would say that you might want to really consider trying the soft gel capsules. Here's the reason why. We actually have lupus patients, which is similar, right? Lupus patients, the immune system is actually attacking your own organs. So our lupus patients actually do very well. All their symptoms improve and their condition becomes under control. Okay, so what you can do is try the soft gel capsule for a month. Even in the worst case basis, guess what? Your general chronic inflammation is going to come down. If you have a little bit of high blood sugar, high blood cholesterol, all this will be improved. So no worries, Lang. For sure, you're going to get a benefit. But of course, on the top of your mind, you are very focused on your condition right now. So try it and see if there's improvement. If there is, then again, speak to our CSOs, our customer service, or have a consult with Dr. Jansen to really tailor the dosaging for better results. All right, but you can definitely look into this.
Okay, our viewers are getting more curious. It's a private question from Miss Joy. Is PPARS also effective in LMD, as in leptomeningeal disease?
Oh, what's that? I have to
Okay. Leptomeningeal disease is a very broad disease, no? So there are a lot of diseases under leptomeningeal diseases. However, there are some leptomeningeal diseases wherein inflammation is a hallmark. Okay. So with those diseases, then definitely PPARS can help, because PPARS has very good antioxidant properties. So it has very good anti-inflammatory effects. Okay. So but just for everybody's knowledge, no, leptomeningeal diseases. So we have a word here, leptomeningeal. So leptomeningeal has two words brought together. Okay? So this is where the disease influences the cerebrospinal fluid pathways. Okay? So our brain is suspended in a fluid. Okay, our brain is suspended in a fluid. Now, this fluid runs down through your spinal cord. Okay, so this is the leptomeninges, no? I'm trying to make this as easier to understand for everybody, because you have to understand anatomy here. Okay, so that space where the cerebrospinal fluid is, so that is your leptomeninges. Okay, so there are a lot of diseases where this specific part of the central nervous system is involved, no? And usually inflammation is a hallmark. So definitely PPAR tablets can help with this. But of course, no, again, the mainstay of treatment, or the treatment that will cure you of the disease, of course, will be other treatments. No? So in this case, Simply Nature PPARS can act as a supplement.
Right. So this is one thing very important in today's day and age, right? You want to go for a complete, how shall we say, treatment protocol, right? So not just drugs or not just natural. So since I'm a strong believer of TCM, natural, integrative, everything, does this mean I don't use antibiotics? Of course, I still use antibiotics, right? But what I'll do is that I will actually delay taking my antibiotics for 1-2 days, let my immune system exercise a little bit, and during those 1-2 days, I'll take a lot of supplements, like a lot of PPAR tablets. Maybe half the chance, so I will definitely still use the antibiotics. But here's the important thing: we've got to really allow our body to work, because many times for men it's good to have a holistic approach to your health.
My stock of supplements aligned with anti-aging.
Yeah, I tell you, funniest thing in the world. There was one time a few more than 10 years ago, I was doing a live broadcast. We actually brought the inventor of PPARS, okay, to Singapore. There was 600 people in the room. So together with him and another researcher, we were basically interviewed by the health channel guru, right? So we were the guests. So we were sharing, and so many people asked so many questions. Like, my husband is taking this drug, that drug. Can we use PPARS? Is there contraindication? All these questions. Then at the last part, I asked everybody to just guess my age, right? And then everybody then their health. So I mean, I just think that that's pretty humorous. Yeah.
Okay. Moving on to the next question from
That actually, and I forgot already. So let me look into my let me look into the references. No, this is usually pediatrics. No, there is a virus there. If I'm not mistaken, it's parvovirus B19.
Yes, it's
It is parvovirus.
It's a pox virus family.
Molluscum contagiosum.
Yeah. Common
Uh,
infection.
Molluscum contagiosum virus. Is it pox? If I remember correctly, it is
Yeah,
pox.
pox virus. Pox virus.
Pox virus. Yeah, pox virus. Yeah. So that's the root cause, no? So when the pox virus infects your kid, no? So as a reaction, the skin produces these molluscums, this very characteristic rash. Okay? Yeah, so that's a telltale sign actually, right?
So what was the question again, Jhen?
Yeah, where does it come from?
Oh, okay, there you go. All right,
Yeah,
so
it's a result of the inflammation of the skin as a reaction of the infection from the virus.
So it's a virus infection, right? So
Yeah.
Okay, going back to cancer from Miss HMB. She has two questions actually. First is it possible or is it safe for a cancer survivor to take collagen tablets?
In general, it is. In general, it is. However, would you want to take a collagen tablet? Well, for educational, for academic purposes, no. Yes, it's okay. Yeah, it's okay.
Okay, so I want to add to this one. It's okay to take collagen tablets. It's okay to take collagen. Just make sure the brand of collagen you take is safe. All right. Go for always. Go for the good brands. Okay, because if you take all these things, you take them more than once. Go for quality. Go for quality.
Okay, her second question is, I heard from one of the alternative medicine doctor that taking a mega dose of vitamin C is good for a cancer patient. What particular name of vitamin C is it?
Okay, wait. Before Dr. Jansen answer this, okay. Dr. Jansen will elaborate, but I just want to say, it is not vitamin C that you buy off the shelf from healthy options or anything like that, okay? The mega dose vitamin C is not the bottle. You know, when you go to healthy options, they have vitamin C, then they have mega dose vitamin C. It's not that. It's not that at all. It's actually intravenous. When they say mega, is imagine you take 3 bottles of those mega dose vitamin C at one time, at one shot. That is the mega dose.
Confusion. Now we have two concepts here, no? Cancer patients taking vitamin C treatment is really good. I have a lot of I personally administer vitamin C for cancer patients, no? And a lot of my cancer patients have positive feedback in terms of their cancer improving. So, what is the improvement that we can expect from vitamin C treatment? So, there are huge tumors, like tumors the size of my fist, okay, that softens. So, that's a good sign. Some other tumors wherein on the surface, no, there are wounds already. Some of them actually dry up. Okay. There are also tumors which are smaller that completely goes away. I have seen such. This is not only true for the tumors, even the lymph nodes, no. So for example, you have a tumor on your breast, no. So the number one lymph node network that would be involved, no, is your axillary lymph nodes. So the lymph nodes in your arm, vitamin C. So let's set this when we compare that to your typical tablet of vitamin C. So one tablet, when you go out there in the market, the most common one that you would be able to buy is 500 milligram per tablet. So we're talking about in the order of 30,000 milligrams. Okay? 30,000 milligrams of vitamin C, which is given in abdominal pains, you will have diarrhea. Okay? These three. Right? And another one is you will not be able to absorb that much vitamin C through your intestine because we have a limit. So the limit is between 500 to 1,000. So beyond 500 milligrams, the absorption of vitamin C from the intestine is going to be very small already. Okay, the more that when you go to 1,000 milligrams. All right. Now, when we talk about high dose vitamin C, the treatment itself already, no, we also do use high amounts of oral vitamin C, more than 2,000 milligrams, or sometimes we also give 6 grams, no, 5 grams, 6 grams of vitamin C orally. However, the type of vitamin C that you have to take is liposomal. Okay, liposomal means it has a special coating so that the absorption from the intestine is 100%. Yeah, so it bypasses the intestinal absorption limitations, so to speak. So that is the only way on how we can augment this. If you this is some an important consideration as well, no, because liposomal vitamin C is very expensive compared to your ordinary vitamin C, which is what, dirt cheap, no? You can actually buy vitamin C out there for 1 peso, 2 pesos, sometimes even less than 1 peso if you use your discounts. Okay.
But the
Now,
one that you say, Doc, is like 9,000 pesos.
yes, correct. I know of one company which sells them for 12,000.
Yeah, at least 12. Yeah, it's $300
Yeah.
about 12.
Yeah.
Correct.
So now of course the cost is quite prohibitive in that sense. So can we still use the regular vitamin C? I do prescribe the regular vitamin C. However, the dosing will be smaller, but you take it more frequent. So instead of, say, for example, taking in one shot 2,000 milligrams, I separate it into 4 doses, sometimes 6 doses. So if you are some of my patients, though, if you are listening, I have prescribed some of you with 500 milligrams, 1,000 once every 3 hours. Okay, so this goes for everybody. So if you do so, say for example, you take 1,000 milligrams every 3 hours. So in a span of during the day, okay, during your waking hours, probably you would be able to take 5, 6 doses. Okay. So with this, you have to watch out for vomiting, abdominal pain, diarrhea. Because if you do so, you have to lower the dose of your vitamin C. Or else it's gonna be terrible. Yeah. So that's how we approach vitamin C treatment.
So actually, to answer this question, right, number one, it is not the mega dosing that you are thinking. All right, it is very different. And as Dr. Jansen has shared, the other symptoms, other side effects. Okay, this is not a natural amount of vitamin C that you can take safely without concern. So anyone considering using mega dose vitamin C for cancer, please have a consult with Dr. Jansen or find a physician who is qualified to help you in this. But we can answer you the basic question: does it help? Does it have a positive effect? The answer is yes. Okay, so you can explore this this protocol option, but don't do it yourself at home. Okay, that's what we're just trying to let you know. So I think that will set you in a good direction. Yeah.
Okay, before we go to our next question, I would like to read again another good comment from one of our avid viewers, Miss Netsi Ocampo. She said, I used AD Pro to our neighbor who has a small spot of psoriasis
Yes.
by the forehead near the hairline. And then it's an autoimmune disorder. And I just used it twice and it vanished immediately.
Wow, see guys, yeah, but you know, for your neighbor, in order to really bring the psoriasis under control, so that it breaks out less. So AD Pro works when it breaks out, but what you want to do is to stop that it doesn't even break out in the first place, right? So for that, you know, Nancy, is it Nancy?
Nessie.
Nessie, please introduce your neighbor. If it's a kid especially, then it's even easier because you need even less, right? Please introduce your neighbor to PPAR tablets. So hopefully after 1 month, they don't even break out easily. And of course, if it does break out, you have the AD Pro that can quickly address the issue.
Okay, thank you, Miss Nessie. Now, moving on to the next question from Facebook, Miss Mavis Kisumbing. How do you treat sebaceous dermatitis, especially of face and scalp?
You can use ketoconazole shampoo, but consult your dermatologist first. Okay, but an antifungal shampoo is usually used for that.
So again, you know, Doc, it seems like there are some like many off the shelf that you can just buy products, but these products actually contain, I guess, strong components that you should be careful to use every day over long periods of time. So I think, you know, yeah, so even not every off-the-shelf product is totally risk-free. They are safe and risk-free for short-term use, right? But many of us really define short-term in very different ways. Some people think using it every day for one to using it regularly.
Okay, another outside the topic question from Miss Minda Banella. Can PPARS help to treat cataract?
Oh, no, no, no. Okay, what is cataract? Cataract is a scarring of your lenses. Okay, so anything that has something to do with scarring, it's gonna be very difficult to treat using medications already or supplements. Okay. For cataract, so imagine your lens, no, the lens in your eyes. It's very similar to the lens of your eyeglass. Yeah. Okay. So the difference is the lens inside your eyes, it can change its shape. Okay. So
That's due to aging, right, Doc? I mean, it's just
yeah,
like, yeah.
it's part of aging. So things that can damage the cataract is free radicals. That it's really the biggest problem, the free radicals, no inflammation. Now, while PPARS won't be able to treat cataract, if you take
Can slow
PPARS,
the
it can
onset
help
of
prevent. It can
Yeah, you
also
prevent it,
slow
right?
the onset or slow the worsening. So in that sense, you can
Yeah.
still take PPARS for patients who have cataract. However, if your cataract is really bad already, go see your ophthalmologist, please, and get a laser treatment. Yeah.
Yeah,
Okay. So you can see again.
Yeah, thank goodness this can actually be treated. Now there is there are there are things that could stop a person from treating it. In that case, then there are things you can do in sort of like so that you can go and have your cataracts treated, right? So consult out Jansen if you want to find out more.
Okay, another question from Viber. It actually was already asked earlier, but let's just repeat for Mom.
Sure.
Yeah. From Mom Sands. Okay, her question is, can PPARS cure IBD, Crohn's? What PPARS should I use? Crohn's disease.
So the answer is yes, but Dr. Jansen, what should they use?
Yeah. If you have Crohn's disease, I would recommend, if it's bad, no, PPARS liquid and the tablets, a combination. Probably be on the liquid for 1 month, then I'll shift you to soft gel. Yeah, so soft gel once a day with the tablets until symptoms gradually goes away. Yeah, so that's how I would approach things. But the initial protocol that I would probably use, depending on the severity of the symptoms, would be the liquid first, then shift you on the soft gels. Of course, both you have to be on the tablets as well. Okay, because the tablets is the complete form. The soft gel and the liquid is just an extract, a paper extract. Okay.
So for this particular viewer, we actually had quite a long answer just now. So perhaps you just joined us, that's why. Okay, but maybe you can, I don't know whether Junie does our AMA, we don't upload our AMA on the YouTube. But okay, short answer is yes. Yes.
Okay, we're almost at the end of the webinar. This will be our last 2 questions for tonight.
Right.
From Facebook, Miss Suzanne Mitra Cayetano. Is my stage 1 cancer related to my itchiness or eczema on the legs part?
What cancer?
She didn't
Yeah.
say.